public health approach to recreational boating injury prevention, an overview of the public health approach in injury prevention. My name is Krista Thalen, and I'm a program coordinator at the Safe States Alliance. On behalf of the Safe States Alliance and the National Association of State Boating Law Administrators, or NASBLA, as I'll continue to refer to them, we thank you for joining us. During today's webinar, you'll learn about the public health approach, injury, and core competencies as they relate to recreational boating injury prevention. This is the first webinar in our four-part series of applying the public health approach to recreational boating injury prevention. More detail about the remaining three webinars and how to register for them will be shared at the end of the presentation. Again, I'd just like to cover a few housekeeping notes. With audio, while our presenters are speaking, please keep your phones or computers on mute. We'll be going back and forth between a few of the presentations and with questions and answers at the end, so I'll gently remind you throughout the session when we want things on mute. We have a jam-packed agenda today, and as you will see with the information updates and insights from our partners that we're going to share, we're going to be strict on timing in order to ensure we stay on track. Each presenter will speak for about 25 minutes, allowing for time at the end for questions and discussion. You will be able to submit questions throughout the presentations by using the chat box found in the area to the right of your screen in the GoToWebinar box. Lastly, during today's session, you will receive an email following it with a link to an online evaluation. Your comments and suggestions are very important to us, so please take a few minutes to complete this evaluation. This is extremely helpful as we plan for future events. I will now introduce our speakers for today. Our first speaker is Ron Sarver, Deputy Executive Director of NASBLA. Ron began his career with NASBLA in 1993. He has worked in many aspects of the association, including staffing policy committees, such as vessel identification, registration, and titling, law enforcement, and preparedness and response. Ron now serves as the association's deputy director. He oversees public policy development for NASBLA and has nearly 30 years of association experience, having also worked with the Council of State Governments, Southern Governors Association, National Emergency Management Association, Environmental Council of the States, and the National Council of State EMS Training Coordinators. He earned the Certified Association Executive credential in 2010. A native of Virginia, Ron attended Berea College in Central Kentucky and graduated from Eastern Kentucky University with a degree in journalism. His favorite boating is on the catamaran anywhere in the Caribbean or on a snorkeling cruise on the Great Barrier Reef. Our second speaker today is Jennifer Woody from North Carolina Division of Public Health. Jennifer has been working in injury prevention for over a decade and is committed to finding and applying the best approaches to our work to make an impact on population health and safety. She is currently the Regional Network Coordinator for the Southeastern and Southwestern United States and is working on a PhD in Organizational and Health Communication. Before I turn things over to Ron, we'd like to take just a minute to have you complete a poll that we are questioning to determine your level of knowledge as it relates to the public health approach. So we'll take just a minute to do that. Okay, see some answers coming in. We'll give it just a few more seconds here. Okay, we have about 90% of the participants having voted, and looks like 32% feel very good about their knowledge with the public health approach, 32% good, 16% somewhat good, 21% not good at all. So we'll go ahead and close that poll so that I can turn things over to Ron. I'd also like to note that there is a handout provided in this webinar that you can download, and it is found in the GoToWebinar panel along the sidebar. So again, that is available for you at any point to download during this webinar. Without further ado, I'd like to turn things over to our first presenter, Ron Sarver.
Great, thanks Krista, and good afternoon everyone. I'm going to give you a little bit of overview of why we're here, what we intend to do here at NASBLA, and with the public health approach, and a little bit about some things that we're already doing. So, the National Recreational Boating Safety Program developed a strategic plan. This was developed by the United States Coast Guard with input from the states and other folks that work in the recreational boating safety community. It was adopted, and it takes a new approach to the recreational boating safety community, at least, to the planning and implementation of the initiatives. This is illustrated in the first item in the challenges and opportunities. The goal is to influence and cause real boat operator and passenger behavioral change utilizing an evidence-based model such as the public health approach through awareness, education, and other interventions that will result in increased situational awareness and safer recreational boating practices while underway. This new approach it's a cultural shift for those of us in the recreational boating safety community. And as such, we thought it was critical for that the major contributors to the implementation and the success of the national RBS program, namely the states, our NASBLA members, become fluent in the public health approach to injury prevention. So that's why we are doing this program with Safe States. We are collaborating with Safe States. This is the first of 4 webinars that we'll be doing within this project so that our members and partners will have the resources to take this public health approach. Other things that we're going to be doing, and we're working with Safe States on this, include providing a centralized, curated microsite for information and resources about the public health approach. We also have an online community with our website called Connect, and we're developing a community of practice there so folks can share information and resources amongst themselves. And we also want to have a centralized place for data resources that states can use when taking this public health approach and using the data that's available. The overall goal is to provide learning, resources, and a community of learned peers regarding the evidence-based prevention models that will increase, hopefully, the effectiveness of the state recreational boating safety programs over time for the RBS program employees and to help the states support the national RBS program and strategic plan. One of the interesting things when I started reaching out to Safe States about helping us with this was that they took a good look around our website and the things that we were doing, and they said, you're already doing a lot of things in the public health approach, things that we would use in doing this systematic approach. We are already collecting and analyzing data. We have, with the Coast Guard, recreational boating statistics that go back to 1960, and we have those available on our website. The states collect the accident and injury data throughout the year, and then every year that is submitted to the Coast Guard, and it's typically published in May. for the previous year. And that's the foundational data that we all build our programs upon. Unfortunately, the best data that we have is the fatality data. Our accident data is pretty good for what we know, but we also realize that there's a good amount of data that's probably out there that we're not catching because law enforcement in the state was never called for an accident or something. Somebody will show up to a hospital with a broken arm or what have you, and that doesn't reach a level. It's probably not going to reach the level where a state recreational boating safety program would be notified. We are looking at non-operators of boats, and this is something new that we're beginning. Up until this point, we have focused in the program almost all of our attention on the boat operator. But it's interesting, we've been taking a new look at statistics, and actually 52% of fatalities are happening to the non-operator, to the passenger. So we're doing some other things now, looking at developing an education standard that'll be for anybody that's on the boat, whether they're the operator or passengers. We're doing some another project with Safe States on a roundtable that'll be coming up. We are also looking at a subset of human-propelled boating or paddling, canoes, kayaks, stand-up paddleboards. We're seeing injuries and fatalities increasing in this population as that segment of the recreational boating community explodes. It's a great entry-level recreation that people can do to get into boating. Doesn't cost a lot of money and doesn't take a lot of time, so we're seeing a lot more with that. Some other things that we are doing is working with our members and partners to define terms and standardize them for improving our data collection. We've done a big accident reporting terms and definitions project. We're also in a very intensive project right now with the U.S. Coast Guard on looking at the entire accident reporting system, from what we're collecting, what the officers are collecting on site, to how that data moves through the state and gets submitted to the Coast Guard for that annual collection. So that's another thing. We have conducted evaluations of boater education programs, looking at states that mandate boating education versus states that only require voluntary or have voluntary education. Interestingly enough, for those on the webinar that may not be in the RBS community, you are not required in the majority of states as an adult to take a boating education course. More and more states are moving to that. It's something that we have supported, but it's taking years to get us there. So we continue to work on that. And that leads to one of our other things is our 10 most wanted list. And I'll be talking a little bit more about that. But these are changes that we would like to see within recreational boating safety. NASBLA has a committee structure that addresses our public policy issues, and our committees have similar areas to those in the public health approach. We have an education and outreach committee. We have an enforcement and training committee. We have an engineering, reporting, and analysis committee. And they are our folks that really take a look at those accident, injury, and fatality data and help us understand that more. A couple of other committees we have are paddle sports, again, looking at that specific user group that is growing in popularity and also growing in accidents and fatalities. And then we have our vessel identification, registration, and titling committee, and we say that's actually the foundational committee because that's where you get all the information about the vessels that people are in. It's the committee that looks at registration data, the types of boats and things like that. So these are committees that NASBLA already has set up, has had for years. And so again, this was one way that we're already kind of working in the public health approach. We're just hoping to do it more systemically. We also have just launched our Certified Recreational Boat Professional Program. It is a voluntary credential, and we found, talking with Safe States, that our CRBP certification has some domains that have similarities with the IVP core competencies. We have management and leadership, laws and compliance, partnerships, marketing and outreach, safety education, and safety training and program development. So again, those all play into work that we're already doing, but it also dovetails nicely with the public health approach. Our 10 most wanted list represents the state boating program's advocacy priorities. It's designed to increase awareness of and support for the most critical changes needed to reduce recreational boating accidents and save lives. Just a few of the ones from our 2018 list are increased life jacket wear, implement mandatory wear in some situations with certain size boats, reduce boating under the influence of alcohol and other drugs, mandate or increase boating education for all powerboat operators of any age. Again, a lot of education requirements are directed at youth, and when we look at the data, we lose far more adults than we do youth in boating. We also are looking to address distracted boating or improper lookout. We also have it on our list to continue that standardized state and federal accident terminology and support implementation of the National Boating Education Standards as recognized by the Coast Guard and by NASBLA. So that's just a few of the things that we have that we're already doing, and the reasons that we're looking at this public health approach and turning to our friends and now partners at Safe States to help us move in that direction. So now I'll turn it back so that Jennifer can tell us more about the public health approach.
All right, thank you so much, Ron. That was really helpful, and I want to say too that part of the reason I was glad that Ron went first is because while I am an injury prevention person, I am not a boating injury prevention person, and I don't know a whole lot about boating injuries. So this is all very interesting to learn a little bit more about what NASBLA does. And with that caveat, I also just want to know that if I use terminology that doesn't exactly sound right to you or whatever, please forgive me. But I will be sharing with you a little bit more about what it means to take a prevention approach or public health approach to injury prevention, which can be applied to all kinds of injury, and thinking about a little bit about what it means for boating. So again, I'm Jennifer Woody-Collins, and I work with the North Carolina Division of Public Health, the Injury and Violence Prevention Program. As I heard from Ron with NASBLA, you all are already doing some of the things that I'm going to be talking about, and that is fantastic. And I really like that Ron talked about how we should, how you're looking to make what you're doing more systematic. And I will be talking a little bit about the details of what that word means and what it might look like for your organization. But again, I am just really excited. Anytime somebody wants to be taking a public health approach, I'll be right there to talk about it. So I did want to start out just by going through some, high-level ideas of what we mean by prevention. So first thing on here we have is that more than 70% of health comes from prevention and factors outside of any individual's control. So what that means is the environments that we live in are have a really big impact on whether we're healthy, whether we're safe, whether we're injured or sick. So just an example is smoking in public places. Now that we don't have smoking in public places, we have a lot less ill effects from secondhand smoke. So again, even if you were not a smoker yourself, 20 years ago, you were being exposed to a lot more smoke than we are now, thanks to public health interventions that changed the environment around where we live. Same thing can be said for seatbelts. Before we had seatbelts, there were a lot of folks being injured or dying in car crashes, and seatbelts helped change that. And that, of course, was a policy change that public health had a role in doing. So on the left side, we have things that are prevention, things that are designed to create the conditions for safety. And we have establishing organizational, local, or state or national policies. So policies are things that focus on whole groups of people and changing the environments and the conditions in which we live. So we're not going one by one and trying to say, hey, stop smoking, or hey, put your seatbelt on. We are changing the literal air we breathe, or putting a seatbelt in every single car that's purchased, so that we just change things for everyone. Again, the second point is making it automatic for people to be able to make the safe choice. So instead of having to require people to take some kind of special action or to learn something or to do something different, we try to make environments created so that they are the safe choice is the easy choice. And so that's just a good way to start to try to think about what we mean when we say prevention. A lot of times in my work, working with folks, people are like, well, we should give, information to people about how to do something safer or differently. And that is wonderful and important, but it's really vital that any communication efforts that you are doing are coordinated with larger efforts. So for instance, with the seatbelt example, if you were to go to schools or whatever and say, hey, kids that are starting to drive, everybody should wear a seatbelt. But if at the same time there wasn't a national movement to have seatbelts put in cars, to have law enforcement there to force it, the education component would not be helpful or reinforced, and you're maybe just wasting your time. So just thinking about making sure that you're not only doing communication, not only doing education, but it's coordinated with lots of other efforts. Same thing with trainings. Again, we might think we need to go out and tell people some important information about how they can behave more safely, but we know that training does not alone do a lot to help people change the way they're behaving. Really, maybe about 3% change could be the most you could expect from communications or trainings. So on the other hand, what is not prevention is things like handing out pamphlets, education alone, trainings, communication campaigns, and other programs that are not related to a larger coordinated effort. So these are just things to get us started thinking about what we're talking about when we talk about primary prevention. So again, it's creating the conditions for safety. That's what we want to have our basic frame. So this is a pretty classic little story that people tell in public health, and it gets to why we use the word upstream when we talk about prevention. So in this picture, we have people up at the top of the stream falling into the river. And a little bit down the river, we have somebody pulling the person out, but some people get missed. So a little bit further down, there's some more people that are there to pull them out, but then there's still other people that keep, they don't get pulled out. The ambulance might be there to help the people that get pulled out to take them away to the hospital. But again, there's still people that we're missing, and not to mention that this is a lot of effort. So what people in the public health approach want to do is put a fence up at the top of this stream to prevent people from falling in the first place. So our fence has a lot of benefits, including that, yes, it may be expensive to put that fence in the first place. It may be hard to get people convinced to, have the land that you need to do it, to pay for it. It may not be pretty. It may be there may be a lot of things that have to be done to get that in place. But once that's in place, it's there, and nobody has to be there all the time saving people from falling into that water. It's way, way, way more cost effective. It's way easier. You don't have to have all these people downstream continuously working and trying to save people that have already fallen in. So again, that's where we get our kind of terminology about upstream and downstream, and we want to think about intervening as far upstream as we possibly can. So throughout my presentation, I'm going to have a few little warning flags, caution flags about some things that can happen when we're working in a public health approach. So fatalism, and especially with injury prevention, it's basically that, there's really nothing that you can do about injuries. Injuries are going to happen. And I challenge you all to think about the word accident and what that implies, because sometimes we can think about accidents as things that are beyond our control, like, oops, I knocked a glass of water over. It was an accident. But the injury prevention approach and the public health approach really says that we know why injuries happen and we can do things to stop them. So on the right, we have a guy who forgot his knee pads, strapped a gas bottle to their head, and it's just not looking well for him to be safe, right? Nothing to do about that guy, right? But obviously, if he were to do a few things differently, he would be a lot safer. So instead of thinking about things as accidents or that, these things are predetermined, we need to shift our thinking to that we can look at data, we know how injuries occur, and we can find patterns that can lead us to ideas about where best to intervene in these issues. So the public health approach, and this diagram is available on the handout that is linked over in the chat box, and I encourage folks to take a look at that after the webinar, because these sort of steps, they kind of take a while to really sink in and understand how this applies in your daily work. So probably each of you will find yourself somewhere in this. Probably not many folks do all of the things on this diagram, but you kind of specialize in one area. But so the first square is about defining the problem, and that has a lot to do with data collection and making sure we understand what's happening. And like Ron said, there's a lot of focus on children's injury, but the data is showing that adults are actually suffering more injuries in boating. So things like that are really important so that we're not working on things that are not actually the biggest problem. And I will, though, also say that in addition to the numbers of injuries that are happening, it is very important to take into account the sentiments of the communities that you're working in. So data also includes if you have a community that's done a community health assessment and they are very interested in drowning, or even if they're interested in something totally not related to what you are interested in, it's really important to not just disregard that and say, yes, but our issue is very, very important. See the numbers, it shows that we have a problem, because in the long run, that's not going to help you win friends and influence people, as Dale Carnegie is famous for saying. And I just a little tip, sometimes you have to kind of let go of your own agenda in order to build the partnerships that you need that will ultimately lead to getting the work done that you're hoping to get done. So the next step, the next box is called identifying the risk and protective factors. So this is looking at what is the cause of the injury. So again, just an example that's also related to data. When we look at motor vehicle crashes, a lot of times people will blame things like texting or alcohol. And yes, these are problems with motor vehicle crashes. But speed is also in the top 3 causes of motor vehicle crashes. And that's not something that kind of naturally comes up for people as an issue, because it's not as talked about, it's not as much in the news, it's not as interesting, or I don't know why. But when you actually look at the data, speed is one of the issues. So you would want to use your data to get at really what's happening, and also once you know what's happening, the risk and protective factors around whatever the issue is can sometimes be indicated through research. If there is no research involved with what is happening with your issue, then it's important that you use what you do know and you make your best guess or guesstimate about what should happen and what should improve the issue. But most importantly is that you're collecting data and you're observing your work and making sure that what you're doing is impactful. So either go with with research that shows what works, or collect your own evidence and try to build the case for what you're doing working. And if it's not working, then change and do something else. The next is related to that, develop and test prevention strategies. So when there is something there, again, go with the research base. If there isn't something, try developing your own program. But again, make sure you evaluate your work. And then finally, ensuring widespread adoption. So once you've gotten something working that's going very well and showing promising results, you want to try to put that in place at as many places as you can. So again, here comes in the issue of policies that you could say, hey, we found this voter education program coupled with an enforcement piece, coupled with a design piece that really has shown promise for preventing voting injuries. We'd love for this to happen, and we showed it works in this community. We'd like to have it happen in as many communities as possible. So again, the idea of population-based, on the left-hand side, this is what I'm going to call a medical model, and the picture is showing a nurse talking to a patient, and I'm again using a smoking example. So she's just trying to say, hey, smoking's not good for you. You really shouldn't do it. I'm going to work with you one-on-one. And that is a piece of getting people to stop smoking and improving health overall from smoking-related causes. But really what we found in public health is all the stuff on the right side. So you have this maybe classic, you maybe seen this before, the smoking is very glamorous ad campaign that I think was from the 70s or 80s. But that's just getting at the piece of changing social norms, reframing what smoking is about. The graph shows the price of cigarettes increasing and sales decreasing. So that's a systems level intervention that affected the price, along with the ad campaign. Down below, we have the smoke-free site around buildings. That is, again, a social norming thing, but it's also reducing exposure to smoke in public places. And finally, we have just the result, which is a big decrease in smoking. So the population-based approach wants to take the combination of everything on the right and make sure they're all working in coordination to achieve the results that we want. Thing on the left is more of a medical model. It can be part of public health, but it is not all of public health, and a lot of times prevention really has nothing to do with medical systems at all. And we'll get to that in a second. So this is a really great series of slides that was put together by my boss, Alan Della Penna, and I think you may be hearing from him in later webinars. But this is just a way to help explain like where we want to be focusing our efforts when we are working on prevention. So the injury event is this red line, and we could say, that's anything that happens to somebody. Once that happens, on the right side, we're going to have first aid, we're going to have EMS called, we might have to have a helicopter, we might have emergency departments. All of that stuff is subsumed in the trauma system, and that's after the event. They may end up in the ICU, CCU, they may end up in rehab, there may, all these things happen, and that's in the treatment and rehabilitation realm of work, and hopefully return to health. Prior to the event, we start getting into prevention. And so this is using a motor vehicle example again. So one of the things that can help prevent the severity of injury, it doesn't prevent the injury from happening at all or the crash from happening at all, is a seatbelt. The police force is also part of that. So again, you're still having a crash, you still may have some injury, but the police are there to reduce that to some extent. Moving further to the left, you have traffic laws and money that it might cost you that may motivate people to not behave recklessly. The seatbelt and police force and law and money fall under the education and deterrence category. ETOH policies are about alcohol, again, laws. Now moving even more towards the left, we have roadway design and alternative transportation. This is getting more to that level of designing context and environments that are going to make it a lot more difficult for people to get hurt. So when you talk about roadway design, alternative transportation, community design, these are things like, I always thought this was really, really awesome. A woman named Sue Baker, who was a researcher at Johns Hopkins a long time ago, had a lot to do with changing the way we design our highways. A long time ago, the guardrails on the side of the road, if your car hit them, they were basically like spears that would just, slice up your car. Whereas now they're made, they're not pointy for one thing, but they're also kind of breakaway or crushable, so that they help lessen the impact of your car hitting them instead of being something that's going to make your crash like that much worse. Things like rumble strips keep you from running off the road. All of these things are in the environment that help us stay safe without us having to do anything special to make them happen. When you talk about design and alternative transportation, those are ways to keep people from driving as much at all. So you're not even exposed to the hazard of driving in the first place. That comes under the realm of planning. So again, prevention is creating safe environments. The further to the left that you get, you're probably working with non-health entities. So again, things like community planners, law enforcement, folks like that. And I always find this pretty shocking that 3% of our health workforce and funding goes into prevention, while 97% of our health workforce and funding goes into clinical and medical care. So that's, I think, just something that we need to be aware of. Prevention is sometimes hard to understand because you are trying to count or show a benefit of something that didn't happen. So you're like, we did so well because so many people didn't get hurt, right? And that's sometimes a hard case to make. So I did want to just pause and remind folks that if they do have questions as I'm talking, they can put it into the question box, and we will get to those at the end, and also questions for Ron. So as we go along, I know I'm saying a lot, and of course I can never see folks' reactions because you're all out there across the country, but luckily we will have a chance to talk after my presentation. So this is going back again, using the same kind of a spectrum model that looks at the left side of prevention all the way down the line to treatment and rehab, with the injury event in the middle. So this again is just talking about kind of the cycle of what we can think about as what is prevention and what is not prevention. So after the event is when you get into all of this trauma system, rehab, help from the doctors. And again, $3.2 trillion spent on healthcare. 97% of the workforce is on the treatment side of things. 3% of the workforce is on the prevention side of things before the event. Getting further away from non-healthcare prevention, from healthcare professionals as you go to the prevention side. I think it's also kind of hard because we have the word health in the concept of public health to really enforce this concept that while we may interface with some medical people, that's really not the focus of what we are doing. So again, closer to the event, you might have education. Further to the left, you have policy and laws, and all the way to the left, you have land use and building environment decisions. So before the event, here's a kind of a list of all the things that you can focus on if you are committed to a prevention approach. These are the types of things that you want to be doing most of your work on. And also, of course, at the event phase there, I think Ron maybe mentioned that you have some engineering focus. So thinking about changing, and this again is a motor vehicle example, but cars have become much safer over the last 50 years with seatbelts, analog brakes, etc. So you can also use engineering of the car or the boat in your case to help folks stay safe in the event that there is an injury or a crash event. So I've applied the same spectrum, hopefully trying to use some initiatives that might happen in boating safety. So on the left side, we might have law enforcement of boating under the influence. We might have life jacket loaner programs. Standards for professional competency can fall on the left side, ensuring standardized national boater education and safety and training policies, and funding for boating safety programs. So all of these are kinds of things that I could envision NASBLA doing as an organization focused on prevention. So again, on the right side, you may be hoping people are trained to be good at first aid, making sure EMS is there. You may want to make sure your trauma centers are good. But again, we want to, again, if we focus on prevention, doing the things on the left side and making sure that they're all coordinated in a systematic way. So what I just talked about is all based on one of our founding documents in injury prevention, which is Haddon's 10 strategies for preventing injuries and violence. And Haddon arranged these from 1 through 10, with the higher level strategies being focused on primary prevention and the lower, again, on rehabilitation. So the very, first kind of gold standard for preventing is don't prevent create the hazard in the first place. So it says stop producing poisonous agents in this case, but this would also mean stop boating. And a lot of times, that's just not feasible, and we're not gonna, we don't want to live in a world where we can't take any risk at all. So then we move further down the spectrum, and until we get all the way down to where we've already been injured, but we're trying to lessen the harm from the injury. And so the Haddon 10 strategies are just a way that you can think about sort of where you're trying to intervene, and in balancing that with what it might mean for the practicality or the political feasibility of what you want to do. So Haddon also has this great matrix that he actually it's actually been modified by injury researchers over the years to add the last column, which is social environment. But he originally had the first 3 columns: agent, victim, physical environment, and pre-event, during event, and post-event down the left side. And the way that the Haddon matrix can be used is to help you think about how you want to design your interventions. So if you were talking about the box that lines up with the pre-event and the victim, you may want to think about things like just people being strong and healthy, being in good physical condition. And that could also apply to during the event, so that people, again, are maybe less likely to suffer severe injuries. And the post-event, if it's the victim themselves, again, pretty much just hoping that they're in good physical shape. But the pre-event place, those are the prevention activities. I think that it's great also to incorporate partners that may be working on during event and post-event things. But again, you can kind of lay out all of your ideas about what would go in each of these boxes. You can think about what capacity you have to do, impact whatever area you can. Think about what your goals are and where you should intervene. It just kind of helps you envision all the different places that you could act in this situation. So the social environment stuff all the way on the right-hand side is getting us more towards the prevention edge. So pre-event, social environment, if you can come up with strategies that relate to the goals that you have that could fit into that box, that would also be possible for you with the resources, capabilities that you currently have, that would be a great place to work. But it's also wonderful to recognize what's feasible and doable for you at this point. And so filling in all the possibilities and then using that as a planning tool to move forward with what you would like to do. So again, we have the prevention spectrum. Again, over here, as I mentioned, the social environment. The EPI triangle, host, agent, and environment, is another way to think about what happens in an injury. So the host is like your body, and or the thing that's getting hurt. The agent is the thing that's injuring you. So that could be a sharp object or whatever. And the environment is what's surrounding you. And looking at all three of those things can help you understand what's happening with an injury. This gets back to the idea of an accident and fatalism, and us thinking that there's nothing to be done about injuries, when actually you can look at that epi triangle of host, agent, and environment. You can map out what happens during an injury on the Haddon matrix, and you can see the places, what leads up to an injury, and where you might be able to intervene. So these are just some tools that can help you break down what's happening in injury events and, again, plan better for how to stop them. So another caution flag I'm going to throw up here is that people can tend to blame individuals for injuries. So, if only they hadn't been drinking, if only they knew how to operate the machinery better, they didn't get enough sleep, or, anything like that. There is, of course, always an element of something the person maybe has done incorrectly, but if there are no laws against drinking and boating in place, or if there is no enforcement of it, or there is no treatment for substance abuse, or there's just so many things that are going around that individual that maybe is contributing for why they would be, wanting to boat and drink at the same time or not be a very safe person. Those are the kinds of things that we really need to shift people's thinking to, because it can be so much easier to say, well, this particular case just happened to be this guy who wasn't very smart or whatever. And we can't let those kinds of narratives take over people's thinking, because it really prevents people from moving again upstream to put those fences in place to stop everybody from falling in the river in the first place and deal with all of the fallout that happens as people keep falling in and getting hurt, spending all that money and having all that pain and suffering. So just kind of be alert for that, even in your own thinking, and especially when you're working with others. Are they trying to shift everything to an individual level, and see if you can have productive conversations that will look at further out on the social ecological spectrum. And I'll talk about what that means in just a second. Right now, in fact. So the multifaceted approach to prevention is closely related to this thing we call the socio-ecological model, which is this beautiful green thing we have on the slide. And it starts out in the middle with the individual, but then it has all of these circles around it that encompass and influence the individual. So there is the person's social network, the institutional or organizational context they're living in, their communities, and their public policy. So again, this is getting back to what is it that is leading to the environment that the individual is living in, that's impacting their behaviors, that's making it easy or hard for them to be healthy and safe. So when you're thinking about what you want to do, and I really like NASBLA's 10 Most Wanted list for recreational boating. I thought that was really great list, and as Ron said, a great way to kind of focus people's attention and get everyone on the same page about what needs to be done. I really liked the, like, for example, the increasing life jacket wearing. That is an individual kind of level thing to want to do. However, there's lots of things that you can do at the other levels of the social ecology that can promote increased life jacket wearing. So within a social network, you can have, you can find out who the influencers are in people's social networks. So is it their friends? Is it their families? Is it their bosses? Is it people in schools? Is it whoever it is? And you can focus your efforts on talking to those people about life jackets. I really like the life jacket loaner programs because in a community, that's something that can be your context where when you get in the water, there's a life jacket available right there for you for free. You don't have to remember to bring one. You don't have to pay for one. And then, of course, policy. If you have rules about wearing life jackets in certain places, that can all just reinforce the habit of wearing a life jacket. So again, just trying to think about what it is that influences an individual's behavior that is in their surrounding context at all these different levels, and thinking about how what you're doing is impacting hopefully the highest level, like the policy level, because that can then influence all of the levels below it. Again, always balancing that with what's feasible, what's politically relevant and possible with your current context. So the next thing I want to talk about is the ultimate absolute importance of partnerships. So I think it's so awesome that you all have reached out to Safe States and are partnering with Safe States. That's so great and wonderful. And I know there's all different kinds of partnerships that you probably already have in place. This is a tool from the Prevention Institute, which is a nonprofit out in California that does all kinds of excellent work. But this particular tool has been really helpful for my own work because I can just tell you, I doubt that you have all the money in the world to do everything that you want, or time, or expertise. I certainly don't. And so I've had to rely heavily, and I always rely heavily on partners who have maybe more funding, more expertise, more access, anything that I can, leverage from a partner is awesome. So this tool just helps you put down who the people are that you want to collaborate with, what's their expertise, what are they trying to get done, and how are they doing it? And then you can, in the middle, bring together what is it that you're all trying to work towards. You can look at what the strengths are that your partners have, and I would put in there too what your strengths are. So the joint strategy, and then that can lead to the joint strategies that will get to you and your partners achieving the goals that you both want. I think it can be, in my experience, it can be kind of hard when you're always, it seems always the player with the least amount of money coming to the table and saying, oh, well, since you have that grant, that it would be really great if you would maybe consider adding this piece on to help, whatever we're trying to do. But at the same time, we have a lot to offer via data, via expertise on different issues. We have connections to additional partnerships. So just being creative about what you can bring to the table if you don't have funding. If you do have funding, excellent. That's a pretty straightforward way to contribute. But if you don't, you definitely have something to offer. Even if it's just being, the person who brings the group together, the organizer, the person who sends out the emails asking people to get together. That is all so helpful and definitely a contribution. So then we have the core competencies for injury and violence prevention. And there's also more about this on the handout that's linked in the sidebar as well. But the injury and violence prevention community, probably about, I won't say 20 years-ish ago at this point, sort of recognized that there was a need to standardize what it means to be a good practitioner of injury prevention. And so they came up, there was a group that formed and came up with these 9 competencies that, again, you individually may not be doing each and every one of these things, but you should think about picking an area that you will be an expert or really developing yourself in, and go for it. So these are standards of what it means to be successful in injury prevention. It enables you to plan as an individual organization for how you're building capacity continually as you progress in your work. And I really like this notion of using this to hire decisions and shape interview questions if you're bringing new people into the organization, because it can just help you say, we already have someone who's really good at accessing data and using data, but what we really need is someone who can go out and talk to policymakers. So that would be number 7, stimulate change. We need someone who's really good at that kind of relationship building piece. So just sort of identifying where you already have your strengths in your organization, and then looking at where you might have gaps. And if you have the opportunity to hire someone, then looking for someone that could help fill those gaps, or looking at ways within the people that you already have who might be interested or maybe has some skill already that they could further develop in an area. So there's a whole set of webinars about the core competencies for injury prevention. There's tons of resources on the Safe States website. And I definitely encourage folks to go and look more into what each of these involves, and kind of think about if you can see yourself in each of those. So I have my last caution flag here. So you can sometimes feel like all of this is so overwhelming, even alone, just thinking about, I need to keep everybody everybody who's ever boating ever safe. And that can be a really hard thing to think about going to work every day and doing. And we don't want to get overwhelmed. We don't want to try to think that we're doing everything all at once. So I don't know who this Chuck Close is, but he has good advice that if you're overwhelmed, then break things down into smaller pieces. So I always find it's really, for me, helpful to have the big picture in mind. I'm trying to every injury that ever happened, could ever possibly happen, anywhere, anytime. I mean, that is our ultimate goal. But of course, I alone cannot do that. So I focus on what my strengths are, what my role is in the process, and just make sure that I am contributing to a larger picture. And if there's a plan in place, excellent. If there isn't a plan that's guiding all the work, then working to create one is super important. And then again, just breaking down your goals and your strategies, finding where you fit in, and finding how you can best coordinate with everyone else can help prevent some of that feeling of overwhelm. So with that, that is all I have. And we are able now to take some questions. And so I'm going to turn it back over to Julie, Kristen, to see if you have any questions. Okay.
Yes, thanks, Ron and Jennifer. What great presentations. And looks like Julie has posted some questions in the chat box. Julie, do you want to review those for us, please?
Oh, sure. Just hoping to engage folks in thinking through maybe who are your strongest partners in prevention currently? Who do you work with most often? And then this could be, if you don't want to respond in the chat box with who your partners are, maybe Ron or Jennifer, you could share some insight into partnerships and those that you have found, maybe some unusual partners that you've found to work really well.
Interesting question. Of course, we always talk about the whole recreational boating safety community, and in that we have everyone from, of course, the states, and then we have the users. The United States Coast Guard Auxiliary, the United States Power Squadrons, those are user groups that are out there. We work with industry, the National Marine Manufacturers Association. one of the things we've tried to get those folks to do is just show people wearing life jackets in their advertising for boating. We think that helps set that norm, societal norm. So that's a partner that we've reached out to. Lots of different ones. Of course, now we're reaching out to safe states to help us focus our efforts here, and we're always looking for partners to help us out.
And I'd just like to add something I was thinking while I was talking and I didn't say, was while we do have many, many, many partners, we've also come to understand that we have 2 or 3 partners that are absolutely essential. You can kind of think of it as a marriage, and it's the people who you don't do anything without consulting them first, right? And then you have some very close friends that you're probably going to ask about some things that are important, but not everything. And then you have some kind of acquaintances that come along when, with certain things happen, but definitely aren't involved with every decision. So in the state health department, since we are focused on the whole state, and we're focused on all kinds of injury and violence, our key partners are the University Research Center, who also has a goal of preventing violence and injuries across the state as well as the whole country. But also we have a task force in our state legislative body that looks at childhood injuries. And that's really our most effective way to get policy done. So the university research folks that do injury prevention, the policy folks that do injury prevention, those are really like the people we're married to that we don't really do anything without. And so I think if you can identify those people that you really want to get really close to and really have a strong relationship with, that's very important.
Thanks. I noted, I dropped in the chat box there, a couple of the attendees mentioned that they work with the Department of Health and their EMS agencies that work within the trauma center.
Excellent.
Great, thanks for sharing. Looks like we're waiting for some more questions to come in. So I have a question for each of the presenters. I'll start with Ron, since we've given him a little break during Jennifer's presentation. Ron, in providing this webinar series to members and partners, what do you hope to see in some future programming at NASBLA? I know you had highlighted a few areas, and with the roundtable session coming up and looking at passengers or non-boaters and providing injury prevention, do you have anything on the horizon that in applying this public health approach in your programming?
One of the things that we're always talking about is data, and looking at that data and finding more and better data. So one thing that I think we'll be talking about is trying to find some of these sources for the injury data that's out there. Like I said in the beginning, we think we do a pretty good job with the fatality data, but we could always improve that injury data. And hopefully working with Safe States could help us identify some things to do there as well. So that's on the horizon, I think.
Okay, great, thank you. Jennifer, my question for you, we've both been in public health for a while, and I'm curious to learn what you feel the public health approach has changed in how injury prevention programs work and can be successful.
So I guess that's a good question, and I don't want to get us too far afield because I have a lot of thoughts about that. But so ever since I've been in injury prevention, I've always had, there's always been the prevention approach has been the focus of what we do. But what I have seen is a trend towards policy work that I think is super important and has really been the aspect of where we've seen the biggest impact for our efforts. So again, I don't think that NASBLA has huge amounts of people available. Public health definitely does not either. So if we are hoping to change environments and create safe conditions for people, we really do need to focus on getting policies changed. And in our case, we work a lot at the state level or the national level. And so while yes, it is hard and it is a lot of work, if you can get a policy change made, you are, in the case of North Carolina, impacting 10 million people at once. And that is way more than you could ever do by trainings or any other kinds of approaches. So I guess that's what I'd say.
Great, thank you. I don't see any other questions that have come through. So at this time, I would like to thank everyone for participating in today's webinar. We hope that it was informative and helpful to your work. And we would also like to thank our speakers, Ron Sarver and Jennifer Woody, for their wonderful presentations. This webinar is available on the Safe States website. The link can be found in the chat box to the side of your screen. And we do intend to get this webinar series also in the Safe States Training Center, as well as the NASBLA e-Learning Center. And through the Safe States Training Center, we can offer CHES and CPH credits for that. So look for that to come in the near future. At this time, I'd like to wrap it up and again say thank you to everybody. And we look forward to seeing you in the next upcoming webinar series. You can see there on the screen, we'll have one coming up October 23rd, diving a little bit deeper into defining the problem and identifying the causes. October 29th, learning more about developing and testing prevention strategies. And then our fourth webinar in the series, ensuring widespread adoption, on November 8th. And the registration link is there, but you can also find more information on our website. Thank you everybody so much, and we look forward to seeing you at a future webinar.
Thank you.